The real cost. Living in public services in the UK today in 2025, the phrase cost of living crisis isn't just a headline, it's the daily reality for millions across the UK. Rising prices, stagnant wages, and stretched public services are shaping how we live, work, and plan for the future. Section 1. The cost of living crisis. Let's start with the basics. What exactly is the cost of living crisis? It's when essential expenses, things like food, energy, housing, and transport rise faster than people's incomes. That means even if you're working full-time, you might be struggling to cover the basics. Here's the reality in 2025. The average grocery bill has risen by over 15% compared to last year. Energy bills, though capped, still remain higher than pre-pandemic levels. Rent and mortgage costs have soared, especially in cities like London, Manchester, and Edinburgh. And wages? In many sectors, they simply haven't kept up. This crisis doesn't hit everyone equally. Low-income households, pensioners, and young people are being hit hardest. Section 2. Impact on public services. But it's not just about prices, it's also about what you get for what you pay. Public services in the UK are under immense strain. Let's talk about the NHS. Waiting times for GP appointments and hospital treatments are the worst they've been in years. Ambulance delays are becoming the norm. And healthcare workers? Many are striking or leaving due to burnout and low pay. Schools are facing budget cuts, larger class sizes, and shortages of teachers. Social care services are stretched thin, leaving vulnerable people without the support they need. It's a vicious cycle. Underfunded services lead to worse outcomes, which place even more pressure on the system.
Section 3. Why is this happening? So, why is all of this happening? The causes are complex, but here are some key factors. Global inflation, triggered by the COVID-19 pandemic, supply chain issues, and the war in Ukraine. Energy price shocks, especially due to dependency on fossil fuels and changes in global supply. Government policy. Critics argue that austerity and delayed reforms have made public services more fragile. Wage stagnation, especially in public sectors like healthcare, teaching, and local government. And while inflation has started to ease, prices remain high. For many people, life simply hasn't gotten any more affordable. Section 4. What's being done? So, what's the government doing about it? Several support packages have been introduced. Energy price guarantees. Cost of living payments for low-income families. Increased minimum wage, but critics say it's not enough. Many believe the root causes housing shortages and HS underfunding and low public sector wages still haven't been addressed. Section 5. What can be done? So where do we go from here? Experts and campaigners are calling for long-term investment in health care, education, and social care. Real wage growth across all sectors, affordable housing development, better regulation of energy and food pricing, a fairer tax system to support public services. This isn't about short-term fixes. It's about rebuilding a system where working people don't have to choose between heating and eating, and where public services are a safety net, not a last resort. Conclusion. The cost of living crisis is more than just economic data. It's about people's lives, their health, their futures. The question now is, will we adapt, invest, and reform before the damage becomes irreversible?